got to do?
So what?
Say what?
We ready?
I don't know.
Well, okay, all right. So today, everybody, this is the morning at the Austin Gynecomastia Center, and we're going to do a really cool video today. This is on the Vaser. This is a big deal because although ultrasonic liposuction is not new, it's been around for a long time, and I used it many years ago. The application of ultrasonic liposuction in gynecomastia has been really amazing. So this case is all about why I think it's amazing. I'm going to go into the whole detail and why I think it's kind of revolutionized stuff at the AGC. And I'm going to talk about the 50 cases that I've done in about 3 months' time here. And we're going to go start off with a patient, this morning's patient. He was all happy to have his video done. So we're going to pop in his room and take a look at him, and we're going to get this thing rolling. So get excited.
Hey man, how's it going?
It's all real time. We filmed it? Woo! We filmed it! Alright, so anyway, he's got a pretty good case of essentially it rises in this area here, comes down through here, and then it goes up into the arm. Okay, so let's get into Vaser a little bit before we actually do this case. So, in essence, there's different types of liposuctions: power liposuction, there's laser liposuction, there's fluid liposuction. There's all these different liposuction techniques. Many years ago, let's say about 25 years ago, there were papers written about ultrasonic liposuction and how it helps to treat gynecomastia cases. They came out with 50 cases over about 4 or 5 years, and they said it was effective. This was from a large group of people at medical institutions. Anyway, we do a lot of gynecomastia here, so we came up with about 50 cases in about 3 months' time, and it was pretty cool. In essence, there's a bottom line with the Vaser. It helps me get a nice result with you that's very predictable, and it's easier than it used to be. What I mean by that is, in the old days, I essentially would have to use some liposuction. I would shrink down this fat, and then whatever I couldn't get out, I would actually put my instruments and my lighted retractors and my electrosurgery device, and I'd be in there and I'd kind of get around this whole mass, pull that thing out. You know, it was painstaking. It was really artistic because you really had to be good at doing a ton of work through a small incision at the bottom of the areola. And that's a lot of the videos that you saw and a lot of the big pieces of tissue that you saw me bring out. Well, the Vaser is really different in that it shrinks this tissue down. It does not shrink gland down. Nothing can shrink gland. It's sort of like having a chainsaw and then you hit a nail. Nothing's going to happen with that. It just dulls your blade. But the idea that most of the tissue samples that I see in gynecomastia patients, they're fibrofatty, which basically means that they have a little bit of gland, but there's a lot of this just fibrous stuff. And so people think it's just fat, but it's not just fat. It's fibrofatty. It's different. It is clearly different. But what I can do with the Vaser is I can whittle it down. And what I do is I get around the top side, I get around the bottom side, I get around the sides, and then I penetrate. And then what happens is it actually frees up this gynecomastia that can be quite stuck to the surrounding tissue. And therefore you have to be really careful when you're doing it the old way. But this, you'll see, it just travels through the tissue and separates the bad stuff from the good stuff. Think of it that way. And then all I have to do at the end of the vasering essentially is to remove the fat with a traditional liposuction, meaning suck the fat out that it melts, and then make the incision a little bit bigger, and it's always a tiny incision, and then grab the tail of this meat, if you think of it, pull it out, and then sever it where it starts, which is really right underneath the nipple. And if we get to see this today, you'll get a great idea of what it does. Now, so then you say, okay, well, what's so revolutionary about it? Well, it makes it a lot easier for me to get a very predictable result. Now, fortunately, I'm a good enough surgeon where I can actually get a great result no matter what. But this makes it just easier and more predictable and more reliable, and that's a good thing. And then the other thing in the post-op state, it's really a big deal. A, there's less pain. B, there's less bruising. And I think this video is going to demonstrate why it's a game changer. So I think you're going to like this, and we're going to have some fun.
You know what I mean? Just do it real time. It's kind of fun. Here's my man on the screen. I mean, it was pretty prominent. I know that we got a good video, but I'm pulling on these instruments here. So this here is the Vaser instrument. This is actually a wand. It doesn't suction. It's just a probe by filling the fat with a special solution of water. Okay, we're ready to start vasering. And again, this is the Vaser probe. It's a hollow probe. There's nothing being suctioned. What the Vaser doing is ultrasonic energy is transmitted out the end here, and it just kind of dissolves fat. And there's always a little skin protector that we use. And I put this probe in. I have a little foot pedal. And then it's on. Yeah. There's a timer. It's a cool looking machine, but that's irrelevant to things. Now, from a strategic, I like that word, calmer. It's definitely easier. I don't sweat as much as I used to. I mean, all right, Mar's up. Mar will finish. Well, so now what's going to happen is water of the latissimus muscle in the back. That's pretty good. Just don't have to do much. This is just, it almost does it for me. Good. So, you know, Vaser, honestly, is a true game changer. And the thing about me to know me is that I just don't sell stuff. I don't pontificate or try to make it attractive for you to come to me just because I have some magic instrument. The magic instrument is these hands. No matter where you go, this is the magic. That Vaser is not magic. When it's used appropriately and used in good ways, what I found is it's a game changer. Now, why is my opinion somewhat valuable? Well, guess what? I've done a lot of these cases, and I've done them a certain way, and now all of a sudden I've incorporated this new technology, and I'm very skeptical. I mean, I had to do 25, 30 cases. Now it's to the point where it's just, it's a game changer. And it's funny, I talk to the people at the company, and they're like, wow, man, you're really excited. I'm like, I am, because I usually don't get excited about stuff that's hocus pocus. This is the real deal. This really works, and it gets you a better result. And so I think that this video helps to demonstrate the improvements that you can get over my conventional techniques. So, you know, that's the definition of a game changer. Used to do it one way, now I almost do it always with Vaser.